Okay, here we're going to go over some common cardiovascular diseases and give you a little bit about what's going on behind them so you can have a greater understanding of what's going on and how the typical process of the cardiovascular system is not working properly. Starting with a very common one, heart attack or myocardial infarction. This is the leading cause of death in the United States. It's caused by an insufficient supply of blood to one or more parts of the heart muscle. So while the heart does go through and move blood throughout the body, because it itself is a muscle, it needs to be supplied with its own blood supply. Coronary arteries can become blocked, as we see here, with plaque, and this can lead to damage to the heart muscle, leading ultimately to a heart attack. Here is the heart disease death rates from 2011 to 2013 in adults over 35 over the country. We see an increased rate of heart attacks in this particular region of the country. How we negate heart attacks, or how they may be hopefully prevented if detected early, such as blockages in the coronary artery, would be through an angioplasty. An angioplasty involves placing a wire mesh to hold the artery open. They will insert this wire mesh through a long tube, typically in the groin region, work its way up to the heart, ultimately getting to the blockage region, and then literally like a balloon, they kind of open this up and they plaster the plaque against the sidewalls. They will then leave a mesh in there to help hold that artery open wide so that blood can easily flow through there, allowing the muscles of the heart to get adequate flow of blood so they can perform their very necessary and continual function. Continuing on to strokes, they typically result with blood clot in your brain, but can also occur with pressure on the brain as a result of inflammation. So it could be an actual blockage, or this is why if there's head trauma, swelling of the brain is a major concern, because that can also lead to stroke-like symptoms. We're looking at the stroke deaths rates across the country. Again, adults over 35 years old in 2002 to 2007. And again, we see a concentration in this particular region of the country. Now, if you think someone's experiencing a stroke, to spot a stroke, they use the acronym here, FAST. For one is the face may begin to kind of weaken or droop on one side. They will be told to put their arms out and keep them level, and oftentimes one will become weak and fall down slowly. The ability to speak might become a challenge for that individual, so they're often told to kind of keep talking and to monitor that. And if this is found out, it would be time to call 911. So this stroke, again, those things to look for: numbness or weakness in the face, arm, or leg, especially on one side of the body. Typically it's not both sides, it can be more evident on one side. There can be confusion or trouble understanding or speaking, sudden trouble seeing or blurred vision, trouble walking, dizziness, or loss of balance. I included a link here where you get to see an individual actually have a minor stroke and are actually explaining to you in the video while it's actually happening to them. So a pretty interesting video there. Now, monitoring blood pressure, we have a size sphygmometer, which is used for two measurements. I'm sure you've had this done in a doctor's office where they put the cuff on and they build that pressure up. They're basically stopping the blood flow. And what they're doing is they're listening for the pulse, and they're measuring the systolic and dystolic pressure, the high point and low point, and they're using this to gauge your blood pressure and ultimately your heart health. Now, those blood pressures, you may hear those numbers of 120 over 80, and this is millimeters of mercury is what they're measuring. Blood flows with pressure through your body. However, too much can cause hypertension, and this can have negative impacts such as damage on your arteries, as well as increase in heart attacks and strokes. So if you know your numbers, you can compare to this. You want to be in this normal green region here. We can see elevated hypertension stage 1, stage 2, and a crisis mode here with seeking emergency care. And this is numbers provided by the American Heart Association. Continuing on to stay healthy, 7 steps to keep a healthier heart. You can take a moment to pause the video and read them here. Smoke for your life, monitoring your blood pressure, healthy weight, watching your cholesterol, controlling your blood sugar, staying active, and having a healthy diet are all components of a healthier heart. It doesn't involve just one thing. It's important to have a healthy lifestyle in general. Wearable devices have become all the rage, and it's helping people keep track of their exercise. but you don't need to go through this high technologically advanced stage. If you just want to calculate your normal heart rate, this is the mathematical equation. You want to feel your pulse, use the second hand of a watch or clock to time 10 seconds while simultaneously counting your heartbeats. Then multiply the number of heartbeats by 6 to get your heart rate per minute, or number of beats equals that times 6 to get your beats per minute. Factors that may affect your heart rate can be exercise, medication, illness, anemia, stress, so on and so forth. Looking at the age groups here, in the ranges of heartbeats, you can do it to yourself. You want to use 3 fingers. I know the image here only uses 2. 3 is a little bit better. And calculate your heart rate, your beats per minute, and see where you fall on this range. Hopefully you're in the athletic to kind of good range, above average, average, below average, and poor. This would be more negative here. You might want to consider living or making adjustments to your life so you're living a healthier lifestyle. So go through, calculate your normal heart rate, see where you fall.